Coming to my own topic, subject which is very dear to me, that is, I'm going to just tell you about the clear road map for Mission Pink. We know this anemia is a silent epidemic as far as our youngs are concerned, and the physical and the cognitive losses due to anemia cost a country 4% loss of GDP, which is 4% is too much. The total of the education department and health department budget is also not 4%. So addressing anemia in adolescent girls is critical, and because it impacts very badly the health and the work productivity and the school grades of these young girls. As for the adolescent girls are concerned, they make 10% of our population in today's time. And we all know that these cutoffs are very clear. This bara low thing was given right in 2000 itself, and we must be very clear that hemoglobin of a girl after 2 years should be more than 12 and 12 plus. So when for an adolescent girl, which is from 10 years to 19 years, hemoglobin has to be 12 plus. And for the boys is concerned, it is 13. It's a big range, and it should be on the upper limit instead of the lower limit of the normal. Anemia is causing red alert, and India is a super capital as for the anemia is concerned. And as for the adolescents are concerned, 60% of adolescents are anemic if we take cutoff as 12 in today's time. Now, I will tell you the story of how the trend has taken place from the time I joined medical college. In 64, I joined medical college, and in physiology department, almost 2 months after we joined, we got a hemoglobin test done. And you'll be surprised to know that only 10% of we Hardonians in that particular class had a hemoglobin of 12 gram percent. And I remember Professor Malik talking to us that if you want to look graceful, if you want to look pink, your hemoglobin has to be 12 gram percent and more. And then we did a lot of work in year 2000, in 98 to 2000, and we almost screened 25,000 girls, children, and ladies from slums. And we found at that time in 2000, the incidence remained the same. 90% of the girls were found to be anemic. Not that the boys were better, but this is it. And now a National Family Health Survey has showed that the incidence of anemia is 60%. Now, this is again a slide from 2000 data. You could find that normal people were only 10 to 12%. This is the government data. And at that time, the severe anemia, which normally kills the people, was 17%. And the rest were in the category of mild and moderate. And in 2020, I just wish to tell you, Dr. Chaturvedi, the figures of severe anemia from 17% have come down to 2%. As for the prevalence is concerned, it is 60%. And we find our because it is badly affecting the cognitive development, the physical growth, and the work productivity of our young girls. The aim of the government has been that there should be a drop in anemia rate by 3% per year. And this, the interventions which they thought of doing it are weekly iron folic acid supplementation, deworming, and along with the midday meal and giving them the advice on the diet. But we have failed miserably on this particular front. This is a slide very, very dear to me. And I think, my two slides, which I'm going to talk now, and the next one, if I've been able to explain to you people, and if you remember it all the time, I think that my job is done. If there is a mild and a moderate anemia, you find there is a lot of, the stores are gone, the tissue iron deficiency is there. It affects badly their child development. The school performance goes markedly down, and the work performance is affected very badly. Now, it is a severe anemia which kills the people. It is not the moderate and the mild anemia which kills the people. Now, this particular slide is, again, very, very important. You can find there is a storage iron, there is a transport and a functional iron. Now, the parameters are for storage iron is serum ferritin, The normal levels are around 60. For functional iron, it is transferrin saturation, which should be again around 35. And the hemoglobin is 12 and 13, depending upon what gender we are talking about. So whenever you find the ferritin levels come down below 15, we say the storage is iron is 0. Now, at that particular stage, the transferrin saturation is normal and your hemoglobin is also normal. Once you find that the functional iron also becomes less, the cutoff for serum transferrin becomes 50, less than 15, and for transferrin saturation also becomes less than 15, but your still hemoglobin is 12 gram percent. So just by doing a hemoglobin concentration, you will not come to know what is happening. But once the hemoglobin levels come down less than 12, the havoc has been created. पानी सिर से बहुत ऊपर निकल गया है. The stores are gone. The functional iron, which is in the muscles. Why are we feeling weak? We are feeling weak because there's no iron in our muscles. And then we doctors, nurses have to become very, very confident as far as this presentation is concerned. And I think, each one of us should explain our patients and then tell them that, once the treatment started, it will take a long time for it to come back to normal. I hope this particular slide and the previous slide is clear to all of you. Now, as for the impact of anemia is concerned, there are 3 as far as the adolescent girls are concerned. Reduced cognitive development, and this badly affects their school performance. Reduced physical development, and impaired sexual and reproductive development. They have irregular periods, and you can find pre-pregnancy iron stores are gone, and they have intergenerational. The problem for anemia is never ending, leading to low birth weight babies. And now, as for the symptoms are concerned, these symptoms are very, very common. But what we find, the experts are getting worried about the impaired educational outcome in our children because the anemia is linked to poor cognitive performance. The concentration issues are there, leading to low academic achievements and school dropouts, which affects career prospects and economic independence. So that you can understand why these 2 things are getting affected. The impact of economic productivity is, again, the WHO says it reduces physical activity by 17% in manual labor and up to 20% in high demand tasks, and thus impacting India's potential GDP by estimated 4% due to workforce inefficiency. This is according to the WHO and the World Bank. Now, what are we worried about it? Our attitude and our public attitude and our family attitude has to change, because India is producing a lazy race, and with a bad school performance, we cannot accept. China is a role model as far as this thing is concerned. Once they brought one-child norm, and they could see that they changed drastically their diet, their exercise, and pranayama was done in every schools. In fact, I will share it sometime else. When you visited the schools, it is a routine that 100% children are taken care for these things. And that is why they have changed the height and everything. So if the China can do it, we surely can do it. Now, the days are gone. In 2000, when we said we used to ask these 5 A's, the choice was there for you to get your hemoglobin level, but not anymore now. The screening has become mandatory for all. And this itself has increased the improvement by 15 to 20% in early intervention outcomes. Now it has been in paper, it has been accepted that we should have anemia room with 40s right in the schools, but I have yet to find that these kind of services are being given by the National School Health Program there. The idea basically is that it is a point of care testing should be done, and then you come to know what is the treatment need to be given to these people. School health or doctors and nurses are visiting these people regularly, but in spite of that, you find this rampant anemia can't be explained. Now, I feel very strongly that the billboards should be there in the school, so child दिन में 10 बार तो देखेगा कि मेरा hemoglobin कितना होना चाहिए. And secondly, the similar billboards should be like this. When you come to know not only the symptoms are there, one can see that if their dark nipples are there, I have a problem. And when I have my nipples are flat, and then again I have a problems. So I think, these kind of billboards are not very difficult to do it. But everything the government cannot do it because it involves money. Causes, we know more than 90% is all nutritional. Hookworm cannot be ignored, and that is why it has become a policy matter to deworm twice a year, irrespective of gender and the age in this particular country. Malaria is still quite a bit of there, and I think, we need to give advice, ki machhardani lagani and all that kind of things. And I think as far as heavy menstrual bleeding is concerned, Dr. Raka has already explained. And when you find that the bleeding problem starts right from the menarche itself, then you definitely know the underlying cause is bleeding disorders. As far as initiatives by the government are concerned, the initiatives have been there from 1970, and you can see the track record, but it is the implementation is poor. The people working, doctors and nurses, are not doing a good job. And this man is heading this particular movement from the front to see to it that the anemia Mukt Bharat is a reality, and same way Kuposhan Mukt Bharat also should be reality. But you find that this survey 5 had been very disheartening, and the efforts were intensified thereafter for in midday meal, IFA supplementation and deworming. You can see here, this particular slide is very clear. जब ये शोर मचा 2000 में, IMA, then Foxy, then IAP, all were active, and the government machinery also moved. And you find the next 10 years, the rate came down from 90% to 60%, and thereafter, इस इंजन की हवा निकल गई. No action. Midday meal has a big promise, provided it is done with a lot of sincerity and honestly. And you can see here that, again, in weekly iron folic acid supplementation, there is no consistency as and the quality of the meals are concerned. It can do really wonders. And it has been seen by many studies, almost hundreds of studies which have been done in the school, where it has been done consistently. The decrease in anemia rate in those schools have come down by 30 to 50%. But here I just wish to tell you, the prophylactic iron folic acid supplementation is meant for boys and girls who have a normal hemoglobin. It cannot take care of severe anemia, moderate anemia, and mild anemia. Then you've got to have a therapeutic dose. Prophylaxis is once a week. But as far as therapeutics are concerned, mild anemia requires 2 tablets given almost for 3 months, and then you track it. Moderate anemia requires 2 tablets, and then again you track after 30 days. If it is not improving, then injectable iron has to be given. Severe anemia goes without any confusion, that they've got to be admitted, and things should be corrected. If you find symptoms are there, then they require blood transfusion, which is Paxil. Otherwise, injectable iron and other things can also be given along with the control. Deworming is very, very important, and you all know about it, that it is done twice a year as far as the government practice is concerned. And this deworming initiative is also very effective and has brought down anemia by, again, 10 to 20% in affected population just by the intervention of deworming. So I think there should not be any confusion is concerned. Diet is important. Deworming is important. Iron folic acid supplementation is important depending upon what is your hemoglobin. And in moderate anemia, because they have an equal number as mild anemia, again, response has to be assessed. And in case if they require injectable iron, it should be given. And severe anemia, because it kills people and they have to be admitted, and blood transfusion, nearly 75 to 80% of patients, it is given invariably. So I feel, what I feel that your aim is to have a hemoglobin of 12. If Western world can do it, we can also do it. This is what my attitude is. If you take any Western word, it's not a small word. Western word and developed word is a big word. And if they can have an anemia rate of less than 5% in their community, then why we should be struggling with 60%? I think it is the winning mindset of doctors and nurses have to be there, and they cannot be casual about anemia in girls. And I strongly feel this is the government policy, and I again repeat, professorial बात करने की जरूरत नहीं है. Time has come, and the WHO says to the government of India only one thing. सिंपल बातें बताइए जो प्राइमरी हेल्थ सेंटर में भी यूज कर सकते हैं, टर्शरी केयर सेंटर में भी यूज कर सकते हैं. उन बातों को हमें याद रखना चाहिए और यूज करना चाहिए. And school health programs, doctors and nurses have to become really vigilant to see what is happening in our schools. And it is awareness and awareness and awareness of parents, teachers, and the students equally. As far as the midday meal is concerned, we now know that a lack of nutrient-dense diet is a major contribution. And that's why dietary diversification is required. The education has to be given to the teachers, to the students, and to the parents on iron-rich foods like green leafy vegetables, soya products, peanuts, seeds, legumes, and fortified cereals need to be part of the school midday meal as well as the family food. Vitamin C supplementation, you all know about it, that deprived patients, their iron absorption can be increased by 50% in people who are taking iron folic acid. If you add vitamin C rich food is given along with them, like citrus fruit or tomatoes, which should be a part of the diet itself. Encouraging traditional iron-rich foods like ragi and amaranth. And again, this kind of promotional campaigns have to be there so the families start using it. And again, it should become a part of the midday meal. And it should be used in a very sustained manner. They are pretty cheap. So it is only the awareness which is required. हमारे बच्चों को खराब आदत पड़ गई है टी कॉफी की. And you all know that the tannins in tea and coffee reduce the iron absorption by up to 50%. And my request to all the doctors who are here that they should not combine in their own families and see to it that children also do not consume at least for 2 hours after the meals this coffee and tea. So खाने की जो सामान है वो क्या खाना चाहिए, it is on the left hand side, and क्या खाने के बाद हमें नहीं खाना, chai, chips, cola and cigarettes. I think these should be well displayed, and people should come and whenever they're just coming and going, they must watch these kind of things right in the schools. Kind of some posters and all should be there. Addressing the menstrual health, I feel that as far as heavy menstrual bleeding is concerned, this AUP problem is there in 1 in 5 adolescents, and they should very clearly know when to contact the doctors. And I think the programs should provide education on menstrual health. The sanitary napkins availability is getting easier over a period of time. This can reduce infection and also which is partly contributing to anemia, should also go away. So my experience as to the government supply of iron folic acid in today's time is concerned, again, is that it is great. It is not the same which used to be there 20 years earlier. And we need to emphasize on the physical activity and the outdoor exposure. It is said that by 30-minute physical activity and the sunlight exposure supports the iron level and the vitamin D synthesis, both crucial for the adolescent health and immunity. We want children with a solid body and a smart mind. So Indian girls and Indian families को जानना है what are the iron-rich diet, and you can see here that ragi, mungfali, all these kind of things which you can see here are very, very important. And people who can afford rainbow diet, it is too much to talk on this particular aspect. But I think पढ़ने वाले बच्चे को should eat an egg and an apple, and you can see few nuts are required, and these pulses and oats and all these things are important as far their food is concerned. And जानते जरूर हैं कि green leafy vegetable खानी चाहिए, but they don't take it, and I think we need to emphasize it. Again, for many doctors, I just wish to tell you that in green leafy vegetables, the quantity of vitamins is almost 200 times more. So that's why our elderly people used to do everything. Chutney बनाएंगे, सब दाल में डालेंगे, रोटी में डालेंगे, everything. They used to mix up these greens. And again, this is emphasizing the vitamin C part of it. And I will just wish to tell you that, ragi, amaranth, few nuts, and green leafy vegetable, whatever is the season kind of thing, these should be given to our children. And mota anaj, I think more and more we start speaking about it, start using it, and start creating an awareness among our colleagues. The practice of our diet will definitely change. As for the fortified foods are concerned, I'm at loss at my own knowledge also. What is being available in our country? Are they available in the country? I was told that some kind of rice fortification is being there, and which is very small quantity, cannot fill the needs of the all Indians as far as this country is concerned. And as for the strategies in paper is there that, the ASHA workers can be used, Anganwadi workers. ASHA workers, you all know that it is for 1,000 people, and Anganwadi workers are for every 2,000 people. They can deliver iron folic acid supplementation in the rural and far-flung areas, as far as, in case if you want moderate and anemias, these supplementation need to be given. Digital platform, our young people are very smart in it, and I think we should use it wholeheartedly, the social media, to have an SMS campaigns for a large adolescent audience. And I feel, let's pledge that anemia-free India should be reality. We should have anemia-free schools, anemia-free families, and anemia-free children. So because the whole strategy which the government has worked out is tackling adolescent anemia is through awareness, prevention, and early intervention. To treat mild and moderate anemia by government school health initiatives and supplementing iron folic acid along with fortified foods in the midday meals, and school-based screening for all, and focusing on the treatment of mild and moderate anemia, and not just relying on once a week tablets. We must emphasize and empower our adolescent girls to pursue education, to be economically independent, and embrace motherhood healthily. Will support both individual growth and the country's broader socioeconomic development. So I again wish to remind each one of you is that our aim is to make anemia Mukt Bharat, and cutoff for that is less than 5% anemia in this country. Thank you very much.